Hi everybody, thanks for joining us today. These are exciting times at Gold Enterprises, and we cannot wait to present to you our ideas of how we can take our company to the next level utilizing some of the latest technologies that have landed in the market. Our team was tasked with researching an emerging technology that would position Gold Enterprises to continue to be the premier healthcare analytics company. After careful consideration, we have come up with a combination of two technologies that will allow us to leverage our expertise and expand into unexplored territory in the ever-evolving space that is IT. The first technology is a tiny capsule camera that is swallowed by the patient. As the capsule passes through the gastrointestinal tract, it can take up to 50,000 high-definition photos that are then sent to our database for analysis. As cool as the capsule is, it only allows the physicians to comb through the photos to find what is wrong. Our company is going to utilize big machine learning AI to do the analysis much faster and provide a report to the physician of any anomalies within the patient, saving the physician's time and money. Because big machine AI like IBM's Watson can analyze unstructured data like pictures and images, we can scan and compare millions of these images almost instantly. The applications for this technology and analysis are potentially huge and can be applied to many industries that touch healthcare. This would allow us to be an industry leader in a very untested but very, very promising new technology. Hi, this is Paul, and I want to spend a few moments talking about our target markets. For this product, there are 3 tiers of markets that each will want to use our technology and research for different reasons. The first tier market is the most obvious. The greatest benefit of this technology is going to be for the physician. The healthcare provider will be able to make the most use of this technology because they are the closest to the patient. The capsule and ensuing diagnostics and analytics will transform the diagnosing and treating practices of the physician, as it will more accurately and completely pinpoint the issues with the patient. This is our primary market because not only does our idea have the most impact in this market, but it also depends on adoption from this market to be successful. The more the healthcare provider market, the hospitals, specialists, family doctors, utilize our product, the more useful the analytics become, as we will then have more records to analyze and compare. This market will also use the secondary data, the higher metadata trends that this will provide as they come up with treatment plans and best practices for treating these issues that we will be able to identify. The secondary markets are the health insurance market and the patient market. These two markets are the primary drivers of adoption as well as the secondary consumers. We believe strongly that patient education and information is critical to successful healthcare and managing costs. The patient needs to understand that our technology is less invasive and more informative than the traditional options. The insurance market is critical because they are a consumer of both the primary and secondary data. The primary data is the data gathered and analyzed for one patient for the treatment of that patient. The insurance company is critical in creating coverage policies based on the findings of this data. They are also consumers of the secondary data. Secondary data is data that's been scrubbed of its protected health information that shows trends and overall statistics of demographically specific patient groups. Healthcare insurance companies will want to utilize this data as they make decisions in step with government regulations in regards to the effects of things like smoking, alcohol, and other choices the patient might be making that increase the risks of certain diseases. The tertiary market is the most removed from the primary data. This market includes pharmaceutical companies, researchers, government studies, and higher educational institutions. This market will not consume any primary data and only use the scrub data for general studies. This group will potentially utilize our technology as a way to conduct controlled studies of specific drugs in trial, or large-scale studies on the effects of diet or the effects of water quality in a population. The application of these technologies are almost endless and immensely useful. The ability to gather this technology over a massive population without the use of surgery or the highly expensive medical supervision will allow all three of the markets to scale their organizations to such a large population for either diagnosis and treatment, drug trial, environmental study, or any other study in which the user wanted to take into account the status of a patient's gastrointestinal health.
Our marketing strategy goal is to sell capsules to physicians for end user use. Our first strategy will be to build awareness from patients so they request our capsule. User audience is 40 to 60, female and male. Channels to include Facebook and television. Paid advertisement to include ads for capsules. Earned marketing is to create a viral campaign with comical messages. Owned marketing is to post 3 times a week on social networking sites. Our secondary strategy is to target physicians to use our products. We will employ sales specialists in every state to market our product. These specialists will be equipped with marketing material and 6 months of training. Experience with physicians will also be required.
By now you all are probably wondering, who is going to manage and compute all the data that will be collected from the capsule? After much research and keeping in mind our core competencies as a team, we determined our best option will be to outsource the processing of our data. More specifically, we believe a cloud hosting platform will provide us with the best case scenario to help make our product and service successful. We've identified Microsoft Azure, Amazon Web Services, and CloudCare as 3 major players in the cloud computing industry. Out of the 3, CloudCare offers services that most align with our mission. As leaders in cloud security and data control for medical enterprises, CloudCare aims to transform the healthcare experience with the industry's most modern, flexible, and powerful cloud-based platform. CloudCare runs its applications on the ClearData Healthcare Managed Cloud on AWS. ClearData exceeds the highest standards in HIPAA compliance, security, and privacy, which allows CloudCare to concentrate on innovation. CloudCare is able to leverage the power of AWS by partnering with ClearData. And by selecting them, we could get the best of both worlds in terms of healthcare exclusivity and IT infrastructure services at a fraction of the cost without sacrificing security or performance. Currently, Microsoft has no official certification for HIPAA compliance.
The big machine cost for our emerging technology can be broken down into 3 major phases. Phase 1 is the model score delivery, which is basically the initial development of the models. During this phase, we'll be doing things such as data extraction, coding the model, validating the model, and also training the model. We have an estimated budget for this particular phase for $70,520. After phase 1 is completed, we will then go into phase 2, which is the patient diagnosis core. During this particular phase, the algorithms will be made to make a diagnosis. With those algorithms, we will be able to determine certain gastrointestinal anomalies. Again, the estimated cost for this particular phase is roughly $39,104. After our algorithms have been made and we have patient diagnosis, we will then go into our user interface, which is our last phase. The user interface will be creating a website for our end users to utilize. The doctors and insurance companies will have secure access to log on to check the status of images and the results based on our big data findings. Now that we know what work needs to be done, let's discuss who will actually be doing the work. We have 4 major project team members, which includes our enterprise architect, our technical lead, our project manager, and our data scientist. Our enterprise architect will spend 192 hours on the project, making an estimated $11,520. Our technical lead will spend $480 hours on the project and make roughly $24,000. Our project manager will spend most of their time on the project, which is roughly 672 hours at a cost of $33,600, followed by our data scientist, who will then spend 480 hours as well, making roughly $34,560. As you can see by a pie chart, most of our resources are actually going to personnel services with 42%. We did get our figures based on external candidates, looked at the market rate for those employees, and then hired internally and used our employees to perform our tasks for this project. You will then see our next most expensive resources or amount of resources going to the model score delivery, which is phase 1 of our project, followed by 16% going to our patient diagnosis core, which is phase 2, and lastly, our user interface, which is 14% of our resources. Again, this does summarize the cost for our big machine costs for our new emerging technology. Thank you.
The vendor selection process of our capsule is one of the most important functions of planning. Selecting the wrong vendor can result in the loss of customers, sales, and even potential health risks. There are 8 core areas that the vendor must be able to flawlessly demonstrate. Those include planning, product manufacturing, project management, quality control, design services, warehousing, inventory management, and drop shipping and tracking. The vendor must have a dedicated team to help plan and formulate specifications for the capsule. Proven results with 10 years of experience within capsule manufacturing. They must be flexible and innovative. The project management team must be engaged and provide updated reporting on manufacturing status. Company must include a quality assurance team. A design team must be able to create and print logos on the capsules. And lastly, a full order fulfillment service must be available and include warehousing, inventory management, and drop shipping and tracking. NutraScience Labs was selected for the capsule manufacturing. NutraScience Labs has a strong history in capsule manufacturing with a tenured contract manufacturing team. With over 50 years of experience, they are the leader in their industry. After several meetings, we found them to be the most innovative company. They offered unique ideas, including flavoring capabilities for our capsule. We see this as an additional advantage and interest in our target market. NutraScience Labs also employs a quality assurance team led by Chief Science Officer Danny Ford, whom is known as an expert in quality control for capsule manufacturing. He does not have a single product recall to his name. NutraScience also recommended new specifications to adapt to all allergens, including gluten-free, vegetarian, and vegan. Their high-speed manufacturing machinery delivers the highest quality capsules with the latest camera imaging capabilities, digestible size, and sustainable materials. They also employ a team of graphic artists. This team will develop the logo on the capsule and offer finishing services. Their presses offer custom mixing to match our PMS colors for our marketing specifications. Lastly, NutraScience Labs will warehouse, manage, and drop ship all orders. All capsules will be stored in a 24-hour, highly secured, staffed, temperature-controlled facility. Their inventory management is cloud-based, which will connect to all of our systems, including CareCloud, our selected data company. NutraScience is not the lowest cost supplier. However, their uniquenesses best position them as the strongest partner for our company. Each capsule will cost $25 to manufacture, including logo printing. They will charge 5% of on-the-shelf inventory and $1 for each capsule shipped in addition to the shipping costs. NutraScience will run an 8-week trial at no cost to our company. They are confident that we will select them for our partner. The vendor selection for our data is important for the transmission and storage of the data from our capsules. The company must be able to immediately receive and secure all images from the capsule. The cloud-based storage must be HIPAA compliant. This includes encryption of data during transmission between the networks, plus a commercial-grade firewall. In addition, a physical data storage secured 24/7 by security personnel is required. There must be different levels of user access based on roles within our organization. Other security requirements include password complexity, session lockouts, and verification questions. Company must be able to connect to other apps, services, connections, and platforms for all-in-one-place functionality. As Gold Enterprises grows, the data company must have scalability. Lastly, innovation is very important to ensure we are offered the latest in data storage and transmission.
As you can see, that Gold team is very excited about our current project. But let me just tell you, we are just touching the tip of the iceberg by implementing this project. The experience we will gain by completing this project can take our company to the new height in the healthcare industry. We are not just only talking about the revenue that we will generate from this project. We are talking about new possibility that will open door after completing this project. There are a few other initiatives that team discussed, and I think it will definitely follow the similar path as our current project. The first one, let's talk about identifying mental health issue and diagnosis. The future prospect is that provider can observe patients' behavior via video camera on a daily basis for a month or so, collect those videos, run through our analytic models, and identify diagnosis and cure for mental disease. The second initiative is create a personal health diagnosis app. By creating app, individual can download that app and describe their symptoms, and we can run our analytic model and provide the solution to those patients. This is kind of moving from B2B market to B2C market. The potential is very high in the personal healthcare area. Third one is a very touchy one, identifying early detections of cancers and cure. If we can have an analytic model that can help us to identify the early detections of cancer, definitely it will be saving lots of life and definitely increasing our business to the high level. Ideas predict that 30% of providers will use cognitive analytics with patients' data by 2018. And as all of us know that healthcare is a $1 trillion industry in the USA, and there are a lot of potentials in this market, and we just need to capture this bigger market share. And as we all know that the future of healthcare industry depend on AI, big data solution, and our company is ahead of the curve by implementing our current project. And we'll just incorporate our current analytic model for future diagnosis, and we'll just ignite this digital healthcare and cure one patient at a time, but prospect cure for a million other patients.
Hello everyone, my name is David Godfrey with Gold Enterprises. As we near the end of our presentation, I would like to provide you with a little insight into where we think this industry is headed. The industry forecast for AI and machine learning in healthcare is more than favorable. AI's current market size of roughly $2.5 billion pales in comparison to the market size of nearly $60 billion in 5 years. With consumer awareness steadily growing and a young, technologically minded workforce still emerging, Gold Enterprises predicts a healthy growth and sustained viability for our new product. From everyone here at Gold Enterprises, I would like to convey our most sincere appreciation for your time and consideration of what we believe to be some of the most exciting new technologies, and an application of which we think will be a game changer for the future of healthcare. We would love to talk more on this subject, so if you have any questions, please leave them in the comments below. Thank you.